Afternoon and welcome to the May 10th, 2023 meeting of the Senior Commission. We currently do not have a quorum, so we will take a 15-minute recess in hopes that we can get that quorum, and then we will adjourn if not.
We have a quorum, and then Nicole can just get started.
Okay, perfect.
Joe can get started.
I'll do the roll.
Yeah.
All right, we now have quorum, so I will now call the roll. Commissioner Ambrosi is absent and excused. Commissioner Chang?
Here.
Commissioner Crawford is absent. Commissioner Knapp?
Here.
Commissioner Starr?
Here.
Commissioner Zamora?
Here. Will Commissioner Chang please lead us in the pledge?
Allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I will now read procedures for public comment.
I can
Hear
do that.
you, sorry.
I can do that part. Citizens addressing the commission during public comment are asked to approach the podium and are limited to 3 minutes unless extended by the chair, and must be regarding items that are not listed on the agenda and are within the city's jurisdiction. The Brown Act does not permit any action or discussion on items not listed on the agenda. No action will be taken on items addressed under public comments.
I will now open to public comments.
My name is Penny Bein-Gessner, and I've lived in Roseville for over 30 years. Recently, I discovered something that caused me great distress. That is the fact that Roseville charges its citizens extra to have emergency medical services when you call 911, a fee that is not billed to Medicare or other health insurances, or necessarily covered by those insurances. This hits senior citizens especially hard since most are on limited income and Medicare and have co-pays of over 20%. The fees are in addition to that which is charged for private ambulances, hospital fees, and doctor fees. This gave me great pause and not want to call 911 in a medical emergency, which in itself is a very dangerous thing because you might need those services, but still an extra $300. I also have a problem when the fire department comes and an ambulance comes. They're both there. Who provides what services? The ambulance is supposed to have a paramedic also. I can see the fire engine gets there first, then the fire engine starts. But in the middle of this, the ambulance comes and the ambulance takes over. So you don't have a follow-through on it, and that to me also presents a problem. I did some research on this and found that many communities do charge this fees and that the fire department does have more trained paramedics than some ambulance services, but now even ambulance services have to have a paramedic on board. I see that there's a great disconnect between the City of Roseville Fire Department, the ambulance service, and the citizens, in the fact that citizens are not made aware of what these are. I know the fee, when I checked, was voted on in 2020, just a couple of months before COVID, and that everything, information and all, became problematic during COVID. But when you are surprised all of a sudden with all your medical bills and an extra $300 that you didn't even know you had to pay, that's disconcerting. So I feel that the city has a responsibility to its citizens to inform them. Thank you very much.
Thank you. Any other public comment? Okay. Move on to the minute. Yeah. Okay. Now, we will. I hope everyone had a moment to review the minutes from our February 8th, 2023 meeting. And if we don't need any more time, I would like to see if there's a motion to approve.
I move to approve the minutes.
A second.
Okay. All in favor?
Aye.
Any opposed? No. Thank you. Now moving on to the next section. Let's see. Item 6.1, the Placer County Health Brain Initiative.
Good morning, or good afternoon. My name is Megan Sponholtz with the Placer County Healthy Brain Initiative, and today I'll be doing a presentation on our program. Next slide, please. So the CDC and Alzheimer's Association partnered to create the state and local public health partnership to address dementia, the 2018 to 2023 roadmap. And then in July of 2020, there were 6 local health jurisdictions awarded the California Healthy Brain Initiative funding. And then recently, just in December of 2022, this funding was extended to go on till September of 2024. And it has been expanded to additional local health jurisdictions. They've added 6 more within California, and this seems to be a growing trend that will continue over the next couple of years. Next slide. The Placer County Healthy Brain Initiative Division, or Public Health Division, received our grant funding, and we have 4 primary goals for this new grant cycle. And the first one is to monitor data and evaluating programs to contribute to evidence-based practices. Second, we'll be focusing on mobilizing public and private partnerships to engage local stakeholders and effective community-based interventions and best practices. Third is education and empowerment of public with regard to brain health and cognitive aging. And the fourth goal is to ensure a competent workforce by strengthening the knowledge, skills, and abilities of healthcare professionals who deliver care, services to people with Alzheimer's disease and other dementias and their family caregivers. Those are our 4 goals that we'll be working on for the next 2 years. Next slide. Our vision statement and mission statement are here on the slide. First, the vision is to foster a community that understands, respects, and supports individuals impacted by Alzheimer's disease and related dementias. And our mission statement is Placer County Healthy Brain Initiative will ensure all residents with dementia, related cognitive impairment, and their caregivers have access to necessary supports and resources so they may remain independent and fulfilled in their community. Next slide. Next, I'm going to be going over a few facts on our Alzheimer's disease in Placer County, some data points that we have. 22% of the current population is 65 plus, and this is expected to increase significantly over the next couple years. Alzheimer's disease is the 3rd leading cause of death in Placer County, and then Placer County is the top 15 counties in California for the incidence of Alzheimer's disease. Next slide. Here we have our behavioral risks surveillance for California, and then the same figures for in Placer County. So for California, 1 in 14 people aged 45 years and older are experiencing subjective cognitive decline. So subjective cognitive decline, SCD, is self-reported memory problems that have been getting worse over the past year. That's how we define it. Less than half of the people with SCD have discussed their symptoms with a healthcare provider. Only 38% of people with SCD have had to give up day-to-day activities, and then 23% of people with SCD need help with household tasks. Here in Placer County, we see that 63% of people with SCD have not discussed their symptoms with a healthcare provider, which is concerning. We want to make sure people get health care figured out early and adjust their concerns. 25% of people with SCD have had to give up day-to-day activities, and 25% of people with SCD needed help with household tasks. Next slide, please. In 2020, we started our needs assessment, and this needs assessment has been driving the work that we are working on. We worked with multiple stakeholders within the community and our coalition. We received national, state, and local data as well as assessed existing community infrastructure and resources to understand how to best make dementia-friendly communities. 4 areas that were assessed in that needs assessment was early detection and referral, public transportation, public safety and emergency preparedness, and community education and engagement. Next slide. This assessment has informed our previous work plan and our current work plan for the next 2 years. Our current work plan for the next 2 years is going to be working on ensuring a competent workforce, policy development, mobilizing partnerships, education and empower, and monitor and evaluate. Next slide. We will be specifically addressing 4 different objectives. The first objective is developing a strategic plan that will guide our work, which we have developed. And then the second objective is develop and engage a coalition. So we do have the Placer County Aging and Cognition Coalition that meets quarterly. Then our third objective is to develop and conduct widespread media campaigns. And so we have had some previous media campaigns. We will be continuing those and developing some new ones to reach all of our target populations within Placer County. Objective 4 is to increase the number of healthcare professionals that are using screening tools. So we will be promoting the Dementia Care Aware program and the CDPH's Assessment of Cognitive Complaints Toolkit. Next slide. So as I mentioned in the monitor and evaluate, we'll be really looking at our strategic plan. So we have developed a strategic plan, and we'll be reporting on our progress to our coalition on each 6-month progress report. Next slide. The next one was the policy development and mobilizing partnerships. So here we have our coalition and we have a health advisory committee that meets to discuss our progress and our plans for our programming. And we also provide trainings to our coalition to improve everyone's education around this topic. Next slide. The big one for our community is educate and empower. So we will be continuing those media campaigns and developing some new ones. We will develop additional educational materials specifically highlighting risk reduction habits for people. Those will be sent out to community. And then we are now hosting virtual dementia tour trainings for caregivers and the community. Next slide. Here's a little preview of some of our previous media campaigns that you might see coming back. And then we will be spreading those through mail, Facebook, YouTube videos, commercials, all the different avenues that they're promoted. Next slide. Our community education, so we have those virtual dementia tours. We have a seniors first transportation guide that is available that is great for seniors trying to get around to medical appointments. We have that digital and printed copies that we are distributing. And then we have developed over 10 educational materials, all in English, and some of them are in Spanish, and we'll be creating more for our populations. Next slide. So our virtual dementia tours, I just wanted to give a quick little spiel about this. So our virtual dementia tours give you the immersion that you have dementia and you have to complete certain tasks. These tours are great for caregivers in the community to really be in someone else's shoes that is experiencing dementia. And it can improve care, so we'll be working with a lot of our caregivers to promote these trainings. Next slide. And then our last one is assuring a competent workforce. So as I mentioned, we will be providing training and technical support to physicians and health systems, monitoring data to see how the physician support changes, and then collaborating with our Dementia Care Aware program. Next slide. Here are some links if anyone is curious about these programs. So Dementia Care Aware is for physicians and it provides additional education and screening tools. The California Department of Public Health's Cognitive Complaints Assessment Toolkit Act is for physicians to, PCPs to do Alzheimer's screenings in their office. So that's a big tool that we'll be pushing. And then next slide. I also wanted to highlight one of our projects that will continue, and that's for public safety and emergency. Project Lifesaver allows individuals that may wander to sign up for this program to receive a wristband that they use in case they wander. They can be located quickly by the police. We currently have 3 cities that implement this: Lincoln Police Department, Auburn Police Department, and Rockland Police Department. They can be contacted for questions about signing up for those services. Next slide. Little highlight on Lincoln's. So they've had over 9 successful search and rescue missions. Each person was safely located within 30 minutes of receiving the call. They currently have 14 enrolled, which is a great number for the newer program. Next slide. Here is our website with all of our information. All of our handouts can be found at this website. We do have resources available for download, connections to community programs and resources, and we can also print different resources. Here's my email and our website if anyone has any questions. Thank you.
Thank you for the presentation. Are there any questions or comments from the commission?
I have a question, where are you reaching out to let people know that this is available to them, this resource? So often the older people don't look for that resource until they're in crisis, and then they just don't know where to go, don't know where to get help. So how are you connecting with them? And it's the children that are usually helping the older family.
Yeah, so one way that we in the past targeted our media was to actually the younger kids so they could help their parents be aware of it. So we did that via social media. And then distributing resources, we distribute our resources to different community groups all throughout Placer County. So resource centers, some physicians have our paperwork and our resources, and just we've mailed out information to addresses and next door. Those are kind of the main avenues right now.
So if they called the city of Roseville and say, what resources do you have, what kind of a response would they get?
I'm not sure from the city of Roseville.
Only because that's what happens, because they don't know Mighty Center exists. They tend to go to the, the communities or the villages, Eschaton for one, since we have, and let them know. But outside of that, people don't go look until they have the need. And what they tell me is the first thing they think of, well, I'll call Roseville or their local community, if they're from Lincoln or Auburn, versus look it up on the web. The kids might do that when they get involved, but sometimes the children are cross-country. So what way can they also, if I'm here and I all of a sudden need their resources, think logically where they might go. Have you gone through a focus group to find out, if I don't know where to get this help, where do I go? So you can make sure that's a connection point for them?
Yeah, so we focus grouped some of our stuff with our coalition, but I'm not sure we focus grouped where to maintain that information yet, and I think that is definitely something that I will do.
Commissioner Knapp, you obviously bring up a great point. It's something that I think what we can do is we can connect with the Healthy Brain Initiative folks and figure out a way to bring some of those resources into some of our community centers and libraries as a resource if people call, their information, their contact stuff. So I think something we can work on is bringing that stuff inside of our facilities.
I think it's really important.
Yeah.
And what I was kind of fishing at is the libraries. A lot of people, they're used to that. If they're not social media in the younger group, the older people tend to go to the libraries or call their city. So those are two, I think, important connecting points that we need to make sure that resource, because it's an important resource for people when they really need it.
Yes, definitely. It's definitely something I want to connect with the city on.
Wouldn't a lot of this start with the primary caregiver? Wouldn't they be generating some awareness for this in their office once somebody is diagnosed?
Yes.
Or are we looking for information before that diagnosis occurs?
Yeah, we're really trying to improve the early detection of it. So as soon as you start noticing some cognitive functions, so yeah, caregivers, family, and friends are usually the first to notice.
Commissioner Chen?
Yeah, I'm just curious how you're planning to interface with the actual caregivers and actually the healthcare community, because if you're starting all this screening process, I don't know how many additional people you'll find that may have some dementia issues, and then I presume you're not making the diagnosis, it's just a screen, and then you'll have them contact their primary care provider for further assessment, in which case, again, how is that going to happen, and is that going to necessarily increase the volume of people looking for dementia care from their healthcare provider?
Yeah, so our work is mainly focused on working with the primary care providers to implement the screening tool themselves. So I work primarily with the healthcare teams to get this up and running because a lot of them don't use these programs already. Does that answer your question?
Yeah, I'm just curious, from previous experience, does that necessarily increase the burden on healthcare providers if there's a significant increase in people seeking dementia care or assessment?
Yeah, so with these assessments, actually, the nurse, they're set up so that not necessarily the provider has to provide the assessment, but a nurse or another person in the office can do the assessment to help take that burden off the provider, and then the provider will then review assessments and talk to the patients about their diagnosis, if they need to be referred to someone, a specialist.
I have a question. How can we encourage or get the Roseville Police Department to be part of this too, as wandering is a big, kind of issue with those with cognitive impairment?
Yeah, so if they're interested in partnering, it's definitely something that we can look into partnering with them on. I think we have in the past, and it just wasn't the right timing, but if it is the right timing, we're more than happy to support that
Thank you.
if we can.
And I will definitely share this with some resource navigators that I know as well too, because I think it's a good thing. I think sometimes people, don't want to kind of say like, oh, we're at this point, and even their caregivers or their loved ones, adult children are the worst with sometimes helping their families do this as well too. So at least another point to point them out and help them. Commissioner Chang.
Just in regards to cost, so I presume at this point in time, this program is fully funded and there'll be no cost to the person that's being assessed. Is that correct?
The assessment is all done through their doctors. So we don't do the actual assessments, the physicians do the assessments, so it depends on what their insurance is.
Okay, but I'm just saying from your program's initial assessment, I understand that it doesn't cover any doctor's fee, but your program's initial assessment, there's no fee to the person or family.
Well, we don't provide any assessments to clients.
Doctor does.
We work on programming with our physicians to implement programs in their clinical setting.
Okay, and then how long is this program funded for?
Until September of 2024, as of now.
Okay, and assuming that it's well subscribed to, what's going to happen then after the funding ends? Is it just going to like fall off a cliff, or is there some plan of supporting some continued assessment of community dementia?
So we will always support it within our public health department. The level just depends on funding available.
Thank you. Any other questions from our commission?
I have one question, and I apologize if I should know the answer to this already, but is there a plan for Placer to do the Age Well in Roseville event that we did last year? Weren't they planning to do that event this year? And if so, would that not be a good place to share this?
Absolutely. We are looking to do something, but we're looking to partner with Placer Connect.
Mm-hmm.
And so they ran one, if you remember, they ran one, and maybe
April.
late in the fall, we ran one early in the spring. And
Yeah.
so the goal is to combine forces and work with them later in the year to provide one big
Still in the
Age
fall
Well.
then? Fall is planned?
I think that's when they run theirs. And so we're going to partner with them and support them and then kind of collaborate. And so
So this would be-
100%, this would be a great resource, a great vendor, if you will, to have participate in that fair, for
perfect.
sure.
Thank you.
Any other comments or questions from the commission? Okay, at this time, I'd like to open to public comment. Or is there any member of the public who wishes to give public comment on this item? Please just, go to the podium.
I have a question about Roseville Police Pass Service. They used to have the bracelet, and when people got lost, they could find them easily. What happened to that program?
That's a good question. I do not know. It's something we can find out. I'm not aware of the program. It might have been before my time, but I can certainly look into that and even try to connect the Roseville Police Department with the Healthy Brain Initiative folks to kind of start that conversation as they have done with other cities. So that's definitely an opportunity.
There was the program, I remember
Yeah.
that.
Thank you. I will now close the public comment. Now on to item 6.2, where we review the commissioner goals. Jeff?
Yes, good afternoon, Commissioner. I'm your Parks, Recreation, Libraries Manager. Just as we've talked about, every time we meet, we just kind of review the goals that were set early in or late this past year in December, and so I'll just kind of review them one more time for the public. Goal number 1 is identification of new seniors moving into Roseville and how to get them linked into our senior community. 2, working with nonprofit and senior living partners. And number 3, improve communication with the senior community about available programs in the city and the county. And so I just kind of open this up to the commission if you want to give you an opportunity to maybe give us an idea or a status report of kind of where we're at with some goals. I know I've kind of worked with Commissioner Starr and Commissioner Chang on some ideas, and I have some report out when it's my time to talk a little bit about kind of where we're moving with that. So I'll just open it up to the commission about any goal status.
Well, I have one thing to add as far as looking at nonprofits. The Jan Whitmore, who brought the support group back, and she's actually the executive director for Northern Cal, and looking at how we can expand this to people being aware of the support groups. The one that is at MIDU right now has over 40 people. Opening the door opened a stream of people who are now either early diagnosis of Parkinson's and want to get ahead of what is coming for them, and some that are sharing about what it's like as they progress through disease. And it's really nice because the group, I'm actually meeting next week with the leader of the group, because I've given her some feedback since I'm involved with a couple of the people in the support group. And they first started off with just wanting lectures, and it's amazing, after about 4 meetings, they now realize how important the support section of it is. So in meeting with the leader of the group, it's gonna be half support and half a presentation by somebody about Parkinson's. So I think it's really good for to listen, to make the move, to make the changes, and for us to be involved. And again, Parkinson's is another community of people. They move to Roseville, they may be moving to a family member who can help with their care because they begin to need more and more care. And then they get involved, where I've kind of moved over into where, in getting their care, they need to go to the caregiver section that's private. And some of them can afford the care and some cannot because it gets very expensive. So I've connected with Del Oro, who does the work with the people who do not have a large amount of funds. And then I'm beginning to gather resources. And I was thinking about the library and where we can get this out to people because, again, they don't know where to go. They start looking up in a book and looking for care. And then word of mouth is amazing amongst this group. They know where they get good care and where they don't get good care, and they tell this. And this is how the 911, because when I finish this, I would like to make a comment on what was said during public comments on the 911, because I've done some follow-through and work with that, because I feel the same way, that people only know about the charge with 911 when they call 911 and get the bill. Most people don't think that I'm going to get charged, so they don't go find and hunt. Now, I know the fire department battalion chief went out to many of the local communities to tell them about it, but that's kind of if you don't use it, it kind of comes today and goes tomorrow until you need it. So the good part is it has developed further in the fact that you have to look for it. And most people don't, and it's with the fire on the city. It wasn't there before, it's a move, they listened to what we had to say, and it's there. There's also an appeal process. So if people feel they've been wrongfully charged, you can at least talk to them. The hard part is the bill comes from a third party, and they aren't very friendly. They just want the bill filled. So I think getting that information, rather than just by word of mouth or when you get the bill and you start calling, again, I feel, interacting with the libraries, people, unless you're looking for this, how do we get that information out to there? And I struggle with that because so often, somehow I get a phone call and I'm trying to connect them. Seniors First is a good connecting point, which is out there. But again, people are kind of 911. And what I've discovered in my research in this area, some charge and some don't. South Placer fire department does not charge because most of their people don't afford it. And when it's a Medi-Cal patient, they don't charge them. But Medicare, they do. And I've called a lot of the healthcare facilities. We have many of them. We have UC Davis, Adventist, Sutter, Kaiser. All their answer is, if Medicare doesn't cover it, then we don't. They do cover the ambulance. So if you go with the ambulance and don't need the care, and I was personally involved, so I learned about the appeal. I appealed it because the fire department got another call, and the ambulance was there, so they didn't do anything. The ambulance did, but that was covered because that's covered under the healthcare benefits. Anyway, to go further, because this is happening to many people, it's been presented to the Placer County Commission. It's been passed on to the Area 4, AAA Area 4, which is 7 counties, and they took it to a watch group in California. So it's not just standing still because it's happening across the country. It's happening in many other states. There is a law passed that because the paramedics have extra training and it costs money, it's not covered by the city, that they can charge for their fees for the service. And when you need a paramedic, they are very well trained and you need them. And I hate to hear some of the older people who don't know that they can appeal, or the real reason why you're calling them is you need the medical care and they can give it, rather than get in a car, which I heard from somebody with a broken leg, driving herself to the ER because she didn't want to get charged. She was charged for something else. So I hate those stories to share. So getting that information out, I think, is a very important piece of what we need to do, however we can get it out. So we need to put our thinking caps on and maybe ask some of the people out there, how do they seek that information? What happens when they get the bill? Some just pay it, and actually I know somebody who got the bill and their wife was transported and pronounced dead, and they got the bill 2 months later, which is kind of bad. It's a sense of, did they give them care, or they had already passed away by the time they answered the 911 call. So I think we need a lot of education around this. Meanwhile, working at how we can best address this and meeting everybody's needs.
Thank you, Commissioner Knapp. I am partners with Commissioner Knapp on the goal of, including different nonprofits. And so we are definitely still compiling the list. It's not like you can go to just one great place and find all these, all these different nonprofits and our for-profit senior living partners as well, too, because the more people that have this information is great. And again, right, the more we can share information. So sometimes what we're learning is the adult children will end up calling, a senior living establishment. And so it's really important to help educate, if maybe the sale's not going to go through and they won't live in your community, what resources or what resource navigator can you at least pass them on to, so that the person isn't just left with, oh, great, there's nothing for me in this city, unless I want to move into one of the big buildings. So I think it's just going to be, Bobby, you said it best, word of mouth, but it's kind of us getting out there and sharing with people. But thank goodness it's a year-long goal and not a monthly goal. Any other commissioners on your goal?
I think, Jeff, did you want to update with what you've been working on for us?
Yeah, so we'll kind of move into the third goal, which was improve communication with the senior community about available programs in the city and the county. So Commissioner Starr and Commissioner Chang kind of have been we've been kind of communicating through email some ideas and some different methods into reaching out to the community. One of those is we are in the process of putting together a short survey, really just asking the community, the senior community, a little bit about, do you know we're here? Do you know what we provide? Do you know where to find our information? And then to kind of start linking them to where that information is. That survey would go out into the FAB newsletter. We're kind of behind a little bit. I think we mentioned this last time. Our FAB coordinator went out on maternity leave, and we've been in transition just to fill that gap. And so, but once she comes back here in the next month, that we'll end up putting something like that in the FAB news. And then it just allows us to kind of get an idea of what people are looking for out in the community. We are starting to move FAB programs here in the coming months over to the west side, out at the Mahaney Fitness Center. So that will give us a little bit of more of an opportunity to kind of ask those questions to really a different active aging community on that side of town. So, and in addition to that, we've since put information in our FAB newsletter where to watch the Senior Commission, how to navigate to the website, things that we haven't had on that before. So meetings like this, you can watch it live, or you can go back and pull it up and watch it at your convenience. So it just gives that a little bit more opportunity for that community to find out what we're doing and what these meetings are about. And then I think Commissioner Starr and Commissioner Chang had great ideas about trying to get the commissioners more in front of the community a little bit. I know we haven't talked about this, but what we're looking at doing is putting bios of the commissioners on the website under the Senior Commission webpage. So, the community knows who our senior commissioners are. And then every FAB newsletter, maybe do a spotlight on a commissioner. So gives, again, the community a little bit more insight to really who our commissioners are and, what drives them to be on the commission and what are some of their ideas and goals. And so trying to connect the community to the commission, and then in addition to just try to identify a little bit what does that active aging community want in regards to programs and services that we might be able to provide in the short term or start to plan for the long term. Certainly, just like anything, we'd like to move a little quicker than we are, but we're making some progress, more progress than we've had in the past. So we're pretty excited about some of the potential outcomes from some of this outreach and some of this communication and reaching out to the active aging community.
I think that's wonderful in the sense that, because I'm out there in the aged community and I help people, is they don't know what we do. Mm-hmm. So often, if I say I'm a senior commissioner, so what do you do? I don't even know you meet. What are your goals? What are you planning on changing? And nobody listens to me. I hear that a lot. I could talk to somebody and nobody listens. I see no change. So they're a little frustrated sometimes when they really want something like a transportation. For a while, they felt they weren't being listened to and didn't even know the name of, I'm trying to find Dial-A-Ride, and it's called Arrow now. It was kind of a surprise to a lot of people. And looking out, because that's one of the things they go look for and want to know more information about. And that brings people to Roseville because we actually have a pretty active senior group in this particular city. So,
and that's where we have to do a much better job. Jeff and Jean and I have shared this as well, of the website presence has to be enhanced. So not just listing the commissioners, a little bio of them or whatever, but we have to have a robust page that is really talking about what we're working on, things we've done, very helpful links that they might miss on the website if they don't know where to go. That's all planned. And so we'll be working with the city on that at some point in the future.
To be fair, I'll just mention this with the webpage. Something that I learned recently is we are going within the next year, I think, to a new webpage. so there's some. We're kind of being asked not to do too much to a web page, knowing that that's going to go away. But, like the bios, and then just making sure that there's resource links potentially on the web page to some of the things that we talked about with presentations and stuff to give those resources back to the Maidu Community Center and the FAB program, and a link to kind of our volunteer desk to at least a place to start. in regards to finding resources. So, yeah, I think we have some good vision for what that webpage would look like in regards to connecting our active aging community to resources.
Go ahead, Commissioner Chang.
Yeah, so Jeff, I'm just wondering, since the process is relatively slow going through the social media and electronic communication, what is the thought about paper communication? I mean, if we're all out and about, could we have like a sheet of paper where we could just hand out and have people take the survey and then bring it back? What's the restraints associated with that? And then in regards to, what does the Senior Commission do? Maybe if we had a little handout or cards that if we actually do the survey with different people afterwards, we can give them this little information card just to explain what we're doing and contact information. So at least that's kind of a stopgap waiting for kind of a more mass communication.
Jeff, I'm thinking we're not doing good marketing amongst our own commissioners. So Commissioner Chang, we have a beautiful one-page flyer on what the commission does that we should get put in your hands if you're looking to hand something
Yeah,
out.
I think
that
if-
was a big goal
did-
of the
yeah.
previous commission.
And we
so
did that, yeah.
Yeah.
And so it's just amazing when I sit here, how many secrets are, we do things and we try and reinvent the wheel because it never got passed on. And I think that's a very important thing, I think, in the commission's history is that we have what we've done and we may have to make it better or adjust it a little bit. I'm thinking as you go forward, because we talked about the 911, is a link off this, if that happens, they don't always think to go to the fire part. They're looking at what resources I have that I can look at in the library, at FAB. So we have to cover a lot of area and asking the people where do they go when they're seeking a piece of information. Is there one place they tend to go more than the other? That might help us in keeping our history also going
Yeah,
forward.
that's part of the survey that's delayed. So again, if we have a paper form, maybe we can at least start getting some information back.
Yeah, I think those are all great ideas. I mean, and all very doable, right? I mean, as Commissioner Zamora mentioned, we do have a flyer. It kind of talks about the purpose and kind of what is the commission about. But we can certainly start. Not only the social media or the email aspect, kind of the boots on the ground, aspect of putting material in your hands. So the next time you're at somewhere that you feel would benefit getting feedback, absolutely. The FAB newsletter is kind of that one-stop shop that we hope that if somebody were to read that would have all the information and links to take them somewhere. So continue to do, we started, I think we've done a decent job, and we could certainly do a better job of getting the newsletter out to to where the seniors are, right? Some of those senior living spaces, senior hangouts, if you will. And that's, again, that would be a start to go, hey, go here, and here's the links to resources, and, here's a place to start to ask, where do I find this? And we have, and I'll just call out Penny. Penny is a volunteer for us at the Mighty Community Center for our senior wing, and does a fabulous job of helping to educate and help seniors in finding information. So we know we have a really good volunteer group to help assist in starting the journey of finding information. So
That's one of your most powerful things.
Yes.
Is people talk to people and when they have a need. And that's great that, Penny, you're a good resource for the senior center because people, and that you're expanding it to Mahaney also. Because when I first moved to Roseville, it was the best kept secret, and I had a 95-year-old mother that I was seeking to find things for, instead of putting her in a very expensive assisted living, which is where some people go. And again, that's one of your areas, because people get desperate, they're working full-time, and what do I do with mom during the day? What are the resources out there? And who do I ask about those? So it's really important, that's what I'm finding, I get pulled back into many times into the assisted living homes, into the home care people that go out to the homes and discover a lot of the things that the families are trying to cover, and they aren't aware of all the resources out there either. So the more we can talk about things, that's been the most powerful right now, is word of mouth. But to getting something that we can hand besides word of mouth that's written what Roseville does. So I think we have a lot of resources, and we're a great town for resources for the elder people. It's getting more information out there. They're becoming more aware of what we do. I think a lot of us are talking, and people are talking to each other. It's not just me. I talk to one, and we play telephone to 10 more. By the way, did you know what FAB stands for? I've gotten that a few times. So they know to seek that there are programs out there. I don't have to go to an assisted living home if I really don't need that. There is things for me to do, to look for when I first come to town.
Yes.
Where does that one-page flyer exist?
I would like to tell you it's on our webpage. It may not be. I know we distributed at the
It's
during
not
the
on
last
the
senior commission.
Are you talking about the senior commission page? It's not there.
Not there,
I
yeah.
believe so.
It was distributed at one of our meetings, but again,
Yeah.
right, I know many of us, when we go back, we put it away. I just know that was something we were very excited as a past commission to kind of bring out as well too. But yeah, kind of reminding ourselves to share it.
Could that be edited to add in the link to the survey or question on the survey?
Yeah, absolutely. I mean, we could do whatever we want. And I know that's been circulated within the FAB's newsletter periodically. It's not a main page, but it, periodically we'll put that in there. But 100%, I think we could kind of this one-stop shop. Here's what they do in addition to here's a survey opportunity that they could either go to or turn it over, fill it out, and turn it in.
And what is the contact on that flyer if people want to know more about it? What did you put in terms of a link or referral? Is it just to the website, or obviously it's not going to be a personal email?
Right.
But
That's a good, I know it went to the webpage, and it went to, I believe it also went to our FAB webpage that kind of talks about the FAB program and programs and classes that are being offered. I'll have to double check what.
it'd be good if there was a generic email address for the senior commission
Yeah.
that somebody on this commission would agree to monitor. I certainly would be up for that.
Okay.
A generic one with the city of Roseville, not a personal one for anybody,
Right.
but a generic one, because we don't have anything like that I'm aware of.
Okay. All right.
People
Yeah,
know where to
good
go.
suggestion.
Are there any other comments from our commission? Okay, at this time, I'd like to open to public comment. Is there any member of the public that wishes to give public comment on this item?
Yes, Penny Beingessner. One problem that people have, commission, the city, have failed to recognize. I'm a volunteer at MyDo, and oftentimes people come in, and we don't always have FAB newsletter available. In fact, we ran out 2 weeks before the end of the 2-month period. So we end up trying to quickly find the page they need or to copy on number one. Number two, a lot of seniors, I say, well, you can go on the web and find it. The first thing they say to me, I don't go on the web. I don't use the web. So we have a disconnect with seniors using electronic media. We also have a disconnect with seniors who do not get out and about for some reason or another. They're stuck at their home. When I first started at the volunteer desk, we did mail the newsletter out to a select few people so that they could have the information. The web wasn't as well used at that time. It has started coming up. More people are using it. But I really wish you would consider about those who are stuck in their home and don't get to the library, don't get to MyDo. We also had a group of people who would take several copies and deliver them to a trailer park that was a senior trailer park. So we had a crew going that would take, and every once in a while I'll have somebody come in, can I have more than one? And certainly you can have more than one to have a friend. Not too often do we have enough to take to these different organizations. So I think that as seniors, city serving the seniors needs to consider those that are homebound, those that can't use the computer either because they don't want to or don't have the resources. Thank you.
Thank
The
you.
printed copies of the newsletter become really problematic when you look at how long they become. I mean, I think I saw one at Christmas time that was like 17 pages or something. How do you print a mammoth article like that?
Yeah, I mean, it becomes a challenge. I mean, you got to kind of balance what you print and what you hope people go to the webpage for. But to Penny's point, I think there's ways that we could designate or hold back copies for if we identify specific areas that we want to take them to. We start to identify a count and put, running those out to communities that we know would be a benefit. So I think there's a lot of opportunity. It just, I think it's the balance. It's trying to find what works and how do we target the most amount of members or seniors within the city.
Okay. Unless there's any other public comment, I will now close public comment. And then now we're on to board member, commissioner, and staff report. Staff, do you have any updates or comments for the commission?
I sure do. Just a couple things that are coming up that I just want to let the commission and the community know that regarding the FAB program. We have Colette Travel Preview Day at the Maidu Community Center, June 8th. This is a travel group who just comes and kind of talks about programs and trips that they're going to be offering here this year and next year. Colette's a very popular group for us that people take advantage of to travel all over the country, all over the world. So that's a great opportunity for people to come out and just listen about what they have to offer and how they run their trips and the benefits of their program. If we're always looking for volunteers. So tomorrow, May 11th, out at the Maidu Community Center, we're doing a Q&A session with the Maidu Museum and Historic Site. So they're looking for docents and volunteers to come and work at the facility, to do tours and work inside the building, to talk about the natural resources and what the museum has to offer. So if people are looking to volunteer some time and be a docent at the Maidu Museum, there's an opportunity there. And then our ice cream social. This is something that we love to do. So it's a FAB appreciation membership ice cream social. In Friday, June 16th, out at the Maidu Community Center. So FAB members, free of charge, come in and we have singers. I think we have a band, a bunch of games being played. Ice cream social, of course. If you're a non-member, you're still welcome. There's a $5 charge if you're a non-member. To participate. So those are just some fun things happening. And the last thing I think I would like to announce is our very own Joe Lopez, which is our secretary. He's been doing this for a few years now, probably more than I know. This is his last meeting, and so he is stepping down, but we are very lucky to have Terry Payne, who is our recreation leader that works out at the Maidu Community Center, will be taking his spot. So I just want to take this opportunity to thank you, Joe, very much for your time, helping me out, helping us out, bailing us out often. You've done an awesome job, and so we're going to miss you, and we appreciate you doing what you do.
Thank you.
So,
Thank you.
It's been a pleasure.
and that's all I have to report.
Thank you. Commission members, do you have any comments or updates for the staff? I have one question.
Yes.
Does the city of Roseville do anything for National Centenarian Day, which is on September 22nd?
I don't know, but we might now. What is that date?
September 22nd.
22nd. That's a good question. I don't know, but I can look into that.
Perfect, thank you.
Yeah.
Okay. If there are no other comments or questions, is there a motion to adjourn?
Adjourn.
Thank you, Commissioner.
I
Ting.
second.
Thank you, Commissioner Knapp. Okay, all in favor?
Aye.
That is it. Thank you.